Welcome, and thank you so much for taking the time to be with us today. We're very excited to present our 10th annual Voice of the Medicare Consumer Survey results, having surveyed more than 20,000 healthcare and Medicare consumers over the past 10 years regarding their shopping and enrollment behaviors. We use this data to help with our development activities and provide our customers and prospects with insights to better connect you to your end users. I'm Jason Schmidtkins, Account Executive with the Connect Your DRX Multi-Carrier Market segment, and I'm pleased to present today with Amanda Woodman, Sales Executive for Health Plans. We've decided to change things up a bit in our presentation format. We are going to share our survey results, but we know the data can be overwhelming and might blur together at times. Amanda and I, where appropriate, have added some additional slides about our digital solutions that support these results. We hope this will be an interesting and informative way of helping you prepare for the upcoming AEP, as well as give you the most value for your time, which we truly appreciate.
Okay, a little bit about Connect Your DRX for those of you who are not familiar with us. We are a SaaS healthcare technology company offering both API and hosted solutions to health plans, FMOs and agencies, financial service companies, and others, all with the goal of pairing beneficiaries with their best fit Medicare plans. Our experience and expertise with therapeutic interchange, drug comparison technology, and analytics helps our customers to improve their customer experience. Our customers do this by connecting members to lower cost drug options proven to help increase medication adherence and star ratings. We have the largest distribution network in the industry, one that offers an easy way to connect health plan products to agents and agents to the plans that they sell. And our proven retention strategies build brand loyalty. Our customers can personalize messages to beneficiaries as their members undergo potential changes in their insurance coverage. And we pride ourselves on being the gold standard in the industry for drug pricing. We leverage plan data directly from carriers, update pricing every 2 weeks, and are careful to source prices at the local pharmacy levels. To set the stage for our Voice of the Consumer survey, we'd like to start with an understanding of the Medicare landscape and the member experience. So according to the US Census Bureau, 73 million Americans will enroll in Medicare by 2030. And if Medicare still exists in 2060, it is projected that 95 million seniors could be eligible for Medicare, a nearly 70% increase over those eligible today. Americans aren't just aging and living longer, they are living longer with multiple chronic conditions. One of the challenges in managing these chronic conditions is to get beneficiaries in their best fit plans from the start. The Medicare landscape points to a hot Medicare Advantage market. 45% of all beneficiaries are in MA plans, and SNP plans account for 20% of the market. This past AEP, every state experienced an increase in Medicare enrollment from 5% to 59%, depending on the state. One big challenge in this landscape, according to a 2021 Kaiser Family Foundation study, is that 71% of all Medicare beneficiaries did not shop for Medicare plans during AEP. Lack of shopping and comparing plans can negatively impact coverage and costs. What's even more concerning is this rate jumps to 85% for those with lower income and less education. These individuals are also more likely to be affected by out-of-pocket costs. And additionally, the Kaiser study found that 50% of beneficiaries have never even visited the Medicare.gov site, and 53% don't use the Medicare helpline for information. If beneficiaries are living longer with multiple chronic conditions, how is it that they're not taking the time to review their current plan, shop for plans that may be a better fit? So the customer experience is a CMS business imperative for health plans focused on improving plan performance and limiting member disenrollment. Health plans and FMOs are challenged to elevate the customer experience, to build trust and increase retention. Health plans also have added pressure of improving quality and performance to earn and keep their star ratings. So how do we support our customers in better connecting them to their consumers? We use personalized data along with our survey data to offer the right digital solutions for each stage of the member journey. So these stages include acquiring new members, engaging members to take appropriate action to safeguard their health and finances, and retaining members to build brand loyalty and keep them for life. The quality of the member journey ultimately manifests itself in the member experience.
Now we'd like to show you our Voice of the Medicare Consumer Survey results, where we surveyed 2,000 seniors at the end of last year. To give you a general idea of our audience, this past year, 65% were female and 1/3 male. In past years, gender distribution has been more evenly split. 90% were over 65. We also surveyed a small percentage between the ages of 62 and 64 to get their perspective on how they view Medicare as they approach 65. 76% are retired and 23% still work in some capacity. 66% are on a Medicare plan only, 16% on an employer plan, and 8% on some other kind of plan. We always like to ask beneficiaries if they have a Medicare.gov account. The number of individuals who said yes doubled since 2020. 42% have a Medicare.gov account, 40% do not have an account, and 18% are unsure if they do or not. At ConnectYourDRX, our Plan Compare One shopping and enrollment solution has a connection to Medicare.gov, so agents and beneficiaries can easily download their drug list to the platform. They can feel confident knowing they are viewing their most current drug list along with the most accurate drug pricing, which is necessary for shopping and enrolling in their best fit Medicare plans. We asked beneficiaries who are already on Medicare and who purchased a new plan if they stayed with the same carrier when buying a new plan. 59% said they stayed with the same carrier. Only 11% switched to a new carrier. 30% were already on a Medicare plan but did not purchase a new plan for 2022. Brand loyalty can be a challenge when individuals retire or age into Medicare. It can also be a challenge for health plans and FMOs when members are faced with plan terminations or drug formulary changes, among others. We offer valuable digital tools and insights to help our customers offer a highly personalized experience to better connect their members to the right information they need at the right time.
So I'd like to share with you two solutions that impact the journey, the member journey beneficiaries go through as they go through these changes. So our PlanSmart Analytics provides relevant member data that health plans and FMOs can use to proactively inform members before a drug formulary or plan change occurs. So through predictive analytics, PlanSmart identifies at-risk members and protects against disenrollment. This data and insights powers outreach campaigns for our health plans and FMO customers. The Medicare Retention Suite is the digital tool that directs members to the right plan based on the data that PlanSmart uncovers. So members can single sign-on from existing customer portals directly to our Medicare Retention Suite, and then this personalized solution allows members to compare their current plan to plan alternatives. The suite also supports members who are aging into Medicare, transitioning from an employer group plan, or are faced with plan and formulary changes, or just might consider switching plans for any reason. One of our new solutions this year is personalized videos. Our personalized videos reside on the ConnectYourDRX platform and connect members to relevant information they need to make highly informed decisions. When consumers make better decisions, this helps increase the conversion rates. Videos are generated based on the input into the platform. And we offer 3 types of personalized videos. Quote videos that show up to 3 plan options. They address the beneficiary by name, include their provider network status, drug, and overall plan costs. Then the beneficiaries can click links within the videos to view plan details, and then they can even enroll directly in one of the plans. There's also a scope of appointment video. It addresses the beneficiary by name, providing an overview of the scope and why it has to be completed before a meeting with a licensed agent. And then we also have consumer education videos, which are personalized to the beneficiary's shopping experience. These videos include an overview of the Medicare plan types with logic to exclude any plan types that are not on the platform. Consumer education videos explain how deductibles, coinsurance, copays, and out-of-pocket maximums determine the cost of in-network care. And these videos also show how including preferences can improve cost estimates and offer a more personalized experience. And they also help the members navigate the platform more easily. So now I'm going to play a short demo of the personalized videos. Here, our Senior Director of Product, Arthur Tu, presents personalized videos to a live audience during the recent MEDICARIANS conference we attended.
I'm going to go and show a little demo of the video. Keep in mind that this video is fully dynamic, customizable. If the member did not pick doctors or is not taking any drugs, those sections won't display. If they're only looking at 2 plans or 1 plan, the video will change in order to reflect the option selected by the agent. And hopefully this works.
Hi, Heather. Based on our conversation, we've determined that a Medicare Advantage plan would best suit your needs. Let's compare the details of each plan. Here are the plan costs. Let's look at which of your providers are in network for each plan. And now, let's look at how many of your prescriptions are covered for each plan. After reviewing this information, you can begin the enrollment process by selecting Add to Cart. Or, to view more information about a plan, click View Plan Details. If you'd like to change any of your preference information, click this button. If you have any questions or concerns, we can be contacted with the information on your screen.
Thank you for your time. We have a lot more features coming into the
All right, we're very excited about that personalized video feature. So moving along here, we asked beneficiaries which carrier they purchased their plan from. United Healthcare was the front runner, with about a third purchasing a UHC plan, up 5% over the previous year. Next was 25% who chose a Blue Cross Blue Shield plan, 14% chose Aetna, another 14% chose Humana, and 6% selected Anthem. And we recognize that Anthem is not owned by Elevance Health, but beneficiaries would have chosen a 2022 plan under the Anthem name. 5% preferred Kaiser, 3% decided on Cigna, and 3% chose WellCare as well. In this chart, we also wanted to give you an idea of which carriers were selected based on age.
So I want to take a moment now to share just how some of our health plan and FMO customers benefit from one of our key solutions, and that's our APIs. You're likely familiar with our out-of-the-box hosted solutions, but you may not be aware that we also offer proven and time-tested APIs, allowing our customers to enhance their own workflows and put data to work at the right place at the right time. Many of our customers start from scratch, whereas others add to their existing platforms to create a very robust customer experience. I read recently that 90% of payers believe APIs are essential to their business strategy. So it's our goal at ConnectYourDRx to offer APIs with the ultimate flexibility and versatility to support these customer-focused journeys. Please note also, however, that some of our largest API customers are not payers. Our API market is broad and diverse. So when we look at our competitive landscape, we really excel in this space. We offer the most detailed level of drug pricing, total cost calculations, pharmacies, and other data within our API toolset. And here are just a few highlights of the data we deliver via APIs, the most accurate drug pricing and annual cost estimates in the Medicare industry, an extensive database of lower cost therapeutic drug alternatives that support medication adherence, key measure for member outcomes and star ratings, as you know. Ease of use keeps members on your platform, technology that is already familiar to them. And our product and technology and service teams have over 15 years of experience with these healthcare APIs.
All right, we asked beneficiaries why they stayed with their Medicare plan last year. Among responders, 57% said they trust their current health plan and have been satisfied with them, which was a 5% drop from the prior year. Only 16% looked for another plan and ended up staying with their current brand after shopping around. Note the 16% who did shop is significantly lower than the 29% who shopped in the Kaiser study we mentioned earlier. However, both of these stats support the fact that most beneficiaries did not shop or compare plans this past AEP. In 2020, in the midst of the pandemic, 13% of beneficiaries relied on their brokers to guide them to their best fit plan. However, in 2021, those who sought broker guidance dropped to 7%. Brokers are still key to guiding beneficiaries through the Medicare maze, however. According to Kaiser Family Foundation, there were more than 3,800 Medicare plans available last year, and the Medicare beneficiary had, on average, 54 Medicare plans to choose from. We know these numbers are sure to rise this AEP. It is difficult for many beneficiaries to navigate through all these plan options without the help of an agent or broker. Finally, only 8% stayed with the same brand because their doctors were on a plan, which was a 2% uptick from 2020.
As we're all aware, field agents will need to stay compliant with the recording of beneficiary engagements starting this AEP. To support this effort, we have expanded our current solution to offer agent call recording for shopping, plan comparisons, scope of appointments, and enrollment. Agents can initiate a recorded call through our Plan Compare One and Medicare Edge solutions. Alternatively, for enrollment-only appointments, an agent can send the beneficiary an email or text invite to call the agent to complete the enrollment. Once connected, agents can proceed as they normally would with their customer. Once the call is finished, the recording is available in the member profile for an administrator to access and review. The process is seamless and easy for everyone involved.
So next, we asked beneficiaries why they decided to switch plans. Beneficiaries who purchased a plan outside their current brand because their broker guided them to a better fit plan dropped 4% in 2021. Money was not as much of an issue in switching, as only 18% changed plans last year due to cost. This is down from a high of 29% in 2019 when finding a cheaper plan was a top consideration. Possibly due to the pandemic waning, supplemental benefits were not a key reason for switching this past year. Only 13% wanted more supplemental benefits versus 25% who switched for more supplemental benefits in 2020, a 12% drop. Overall, beneficiaries are happier now with their insurance carriers. 14% switched plans because they were not happy with their plans or carriers in 2021. In 2020, 15% were not happy. A lot of progress has been made since 2019 when we saw a high of 26% who switched because they were not happy. We also asked beneficiaries how they compared carriers and plan options. Only 30% of beneficiaries visited the Medicare.gov site to compare 2022 plans. This is down from 38% who visited Medicare.gov to choose a plan in 2021. This is interesting since we also learned in a prior slide that the number of people who have a MyMedicare.gov account doubled over the previous year. So even with a MyMedicare.gov account, they aren't going to that site to compare plans. 5% fewer individuals called a broker to compare plans last year, and those who visited a carrier site to compare plans dropped 4% as well. 24% did not compare plans or carriers at all, whereas in 2020, 14% did not compare plans. When beneficiaries are not comparing plans, it is more important than ever that we arm our health plan, FMO, and agency customers with the right data, including pre-populated information on their platforms like demographics, drug data, and health status, to make it easier to connect directly to consumers with personalized information so they can make more informed decisions. With the high cost of drugs affecting many beneficiaries, we wanted to learn if seniors even shop around for lower cost drugs or therapeutic alternatives. And if so, where they do go to compare those costs. 52% of beneficiaries say they compare drugs and drug prices online. 38% said they prefer to compare drug prices on their health plan website versus 21% who go to a pharmacy website. Last year, 24% said they keep track of drug prices by asking their pharmacist. Here, you can also see the comparisons over time with this question, the most noteworthy being that asking a pharmacist directly has dropped since 2019.
As drug pricing transparency and the member experience become more important to star ratings, it is the perfect opportunity for health plans to engage members directly by using prescription data to proactively reach out with lower cost alternatives. We offer two powerful digital tools that empower target audiences to act. Our database RX therapeutic interchange arms health plans with information they use to develop the member outreach programs. They can inform members with personalized messaging about how they can reduce the cost of their prescription. Database RX is the time-tested therapeutic interchange database maintained by a P&T committee. The data set has over 42,000 active NDCs in 140 drug classes and includes dose and condition level therapeutic alternatives. To give you an idea of the savings potential of this database, we analyzed nearly 9 million prescription drug claims from the CMS formulary reference file and found that 32% of these drugs had lower cost options in our database, which is a savings of 219 million. And then Drug Compare is a popular member self-service drug comparison tool. So with Drug Compare on a health plan website, health plans can direct members to do their own research. With full price transparency, members can often find out if there's an appropriate alternative to a high-cost medication that they've been prescribed. And even if a small portion of the targeted members make the switch, the savings can be substantial. People save 50% on average per alternative, with over 100 million in savings being reported each year. This data and having alternatives also strengthens the relationship between members and their health plan, and it helps build future strategies for new plan designs by using our pre and post claims data reporting. And then when it comes time for CAHPS surveys, members will remember it was their health plan who helped them save money.
We try to put ourselves in the minds of the Medicare consumer to find out what they think about Medicare. So we ask them, what is your overall impression of the information you receive about Medicare and Medicare plans? The percentage of those who do not research Medicare plan options increased from 18% in 2020 to 24% in 2021. This is consistent with the fact that beneficiaries did not shop or compare plans this past AEP. 22% of beneficiaries easily understood their plan options after their own online research. Those who remain confused by their options dropped slightly. 25% still rely on their brokers to help them understand their plan options. We also asked what is most important to a beneficiary when they are researching and shopping for health insurance. When beneficiaries research and shop for Medicare insurance, getting trusted broker guidance is still important. 31% want assistance regarding carrier and plan options. However, 28% of digitally savvy consumers are comfortable shopping and enrolling online with little broker assistance, a stat that has remained consistent over the past couple of years. Curiously, 21% said they are not likely to do any of these things. 13% called the carrier directly to see what their plan options were, and only 8% get advice from family and friends. So what makes a plan a best fit for any Medicare beneficiary? Overwhelmingly, 70% said their best fit plan is the one with the lowest net cost. This is when all things are taken into consideration: plan and drug costs, coinsurance, etc. 49% said their best fit plan is one with the lowest out-of-pocket costs, and 36% said it was the one with zero premium. 35% said the best fit plan had the best supplemental benefits, and 33% the lowest drug costs. 21% said it was the one that their broker recommended. At ConnectYourDRX, we focus on the best fit plan because all things matter. Accurate drug costs are critical to determining reliable out-of-pocket estimates, which all contribute to the lowest net cost to a consumer. We also ask beneficiaries how they feel about the Medicare system overall. Do they trust the system? There was a 4% drop in those that said they trust the system from last year, with 52% saying they trust the system overall. 58% said they trust Medicare.gov, 56% trust private insurance carriers, while 32% trust independent insurance agents and brokers.
So in conclusion, Medicare beneficiaries are aging and living longer with multiple chronic conditions. Overwhelmingly, they are not shopping for or comparing Medicare plans, which could be causing them to miss out on their best fit plan options. But it's no wonder when there are so many plans to choose from. More than half still trust the Medicare system and private insurance carriers, but this has dropped slightly from the previous year. They still look to brokers for guidance, but digitally savvy beneficiaries are comfortable doing their own research online. More than half compare drug costs and prefer to go to the health plan websites to do their research rather than visit pharmacies online. Overall, the majority of beneficiaries are happy with their Medicare plans and insurance carrier brands.
We thank you for your time today in reviewing the Voice of the Medicare Consumer survey results, along with key digital tools that will help you acquire, engage, and retain your customers. We highly encourage you to visit our website to learn more about our solutions. Please visit connecture.com to download a copy of our survey results and on our thought leadership page. Thank you again, and we sincerely look forward to seeing you on one of our future webinars as well.